welcome to today's COVID-19 update. I'm Heather Fairbairn, and I'll be your moderator today. Before we begin, allow me to introduce the Honourable Iain Rankin, Premier of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Premier.
Thank you, Heather. Hello, everyone. Before we get into the case numbers, I want to address a personal issue. And this is something that is well known amongst my family, my circles of friends, and much of my community. And I want all Nova Scotians to hear it from me. It involves my behavior as a young man, behavior that I'm not proud of. In 2003, I was found to be driving under the influence. I was fined and my license was suspended for 1 year. 2 years later, I was charged with the same offense, but was eventually found to be innocent. I make no excuses for my behavior. I was wrong, and I made a bad decision. I'm very, very sorry for my actions half a lifetime ago. I was selfish. It has not happened since, and this is something I told my leader, Premier McNeil, and the party when I ran as an MLA in 2013. Again, when I decided to run for the Liberal leadership, I disclosed it. I've never kept it a secret. I have moved on with my life and always drive responsibly. Before I was elected and since I became the MLA for Timberlea Prospect, I have not driven under the influence since. And this is all I will be saying about this, and now I want to get into the case numbers. We are reporting only one case today, and we continue to manage a couple of clusters in Halifax and in Glace Bay. We have mobile testing units in place, and the cases appear to be contained. We are 1 week into phase 3, and I like what we are seeing. Our border has been open for a week now. There's lots of movement in and out of the province, and we are still seeing low case numbers. We are in a stable position, and I'm grateful to all Nova Scotians for continuing to follow the public health protocols. It shows that our vaccination coverage is increasing, and we are building an immunity against COVID. Today we reached another milestone, and it's a big one. Take a look at those happy pictures behind me at the IWK. We hit our 1 million mark. 1 million doses delivered. That's huge and something for us all to be proud of. And I want to thank the staff at the IWK, but also all those working in our many clinics across the province, those in pharmacies, doctors' offices, and fire halls and community centers. All of the medical teams and staff and volunteers, we would not be here without your dedication to helping people get vaccinated. And to all Nova Scotians who are eligible and able, thank you for getting your shot. If you haven't yet, please book your appointment. We will be administering 140,000 doses this week and another 180,000 the week following. And we are now administering mostly the second doses. Our youngest citizens who require Pfizer may have a slight delay in getting those first shots, and Dr. Strang will have more details. But when it is your turn to book either a first or second, make that appointment. The vaccine is our best defense against COVID, especially the variants of concern. And today, the federal government opened our Canadian border with restrictions. But it means that Canadians who live abroad can come back to Canada, and also Nova Scotia. People who can show proof of 2 vaccines will not have to isolate. And those with 1 vaccine will have to isolate for 7 days and get 2 negative tests. Anyone who has not been vaccinated will have to isolate for 14 days. We are monitoring all travel in and out of our province to look for cases and determine patterns. But so far, so good. I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. And I hope everybody did have a good long weekend. Cases remain low, but we still have 2 contained clusters, one in Halifax and one in Glace Bay. Many of these people have not been vaccinated, and that is a significant contributor. Public health continues to respond with mobile testing and where appropriate on-site vaccinations, and we are not seeing spread into the broader community at this point. As I said last week, we will continue to see this type of case activity in all likelihood as we increase vaccine coverage. Ongoing testing and continuing to wear masks inside and indoor public places, maintaining physical distance and limiting gathering numbers remain important while we carefully reopen and build our collective immunity to this virus through 2 doses of vaccine. Last week, we entered phase 3 of our reopening plan and opened our borders to Canadians outside the Atlantic provinces. Staff at our airports, the land border, and the PEI ferry report heavier traffic since June 30th. And I hope that means many of you got to see friends and family that you've been missing for a long time. We are seeing some slowdowns at the border, particularly at the airports when people are arriving from outside Atlantic Canada, don't have their safe check-in form completed in advance. So please, if you're traveling from outside of Atlantic Canada or you have family or friends coming to visit you, make sure that the online form gets completed before anyone travels. And I also want to clarify isolation requirements for people from outside of Atlantic Canada who've had only 1 dose of vaccine. The way you isolate does not change simply because you're now partially vaccinated. You still need to isolate away from others, even if the person you're visiting or people you're visiting are fully vaccinated. If you have to share a washroom within a home, it needs to be frequently cleaned and disinfected. With 1 dose of vaccine, you also need 2 tests, one on the first or second day of isolation and another on day 5 or 6. And you can end your isolation after 7 days if both of your tests are negative. And if you're unvaccinated, you still need to isolate for the full 14 days. We also recommend you get 2 tests, one at the beginning and one at the end of your isolation. On Friday, we announced we will align our border measures with the first phase of the federal government's measures for international travelers, which took effect early this morning. Canada's borders are slowly reopening. While the federal government has not changed who is eligible to enter Canada, they have relaxed entry requirements for those who are fully vaccinated with a Health Canada approved vaccine. As of today, anyone allowed to enter the country will also be allowed to come to Nova Scotia as long as they follow the necessary federal quarantine requirements. The federal rules for international travelers are the same as Nova Scotia's rules for fully vaccinated Canadians, but stricter for those with 1 or no doses of vaccine. The federal government no longer requires approved international travelers to quarantine if they are fully vaccinated at least 14 days before arriving in Canada. If fully vaccinated and arriving by air, they do not need to stay at a government-authorized hotel. And there are other mandatory federal requirements that travelers must meet, including pre- and on-arrival testing. The testing is critical to protect our borders and identifying and isolating cases before they can spread. And while we don't require additional testing for international travelers, we'd encourage them to get tested while they are in Nova Scotia. Allowing fully vaccinated, federally approved international travelers to visit our province is another step in our cautious reopening plan. Our approach has been slow and steady, and so far, it's working. Cases are staying low, testing rates are steady, and Nova Scotians continue to get vaccinated. But there's no question that reopening, while exciting, also carries some risk. The more we open and the more people who come here and move around the province, the more risk we have until we have a high second dose coverage. The vaccine is our best line of defense against COVID and its variants. And today, as the Premier said, we marked 1 million doses administered in our province. It's impressive considering that this time last year, the vaccines did not even exist. If we can really boost our vaccine coverage rates this month, we may be able to reduce some of the public health measures before the end of the summer. Sorry, I missed a page. Let me go back. The vaccines did not exist a year ago, but we still have work to do, and this is a challenge for all Nova Scotians. Moving to phase 5, or stage 2 in our reopening, requires a high proportion of eligible Nova Scotians to be fully vaccinated. So the sooner we reach phase 5, living with COVID, the sooner we can start to lift more restrictions and mandatory measures. But it's up to all of us who are able to get vaccinated to get 2 doses as soon as we can. Right now, 73% of Nova Scotians have at least 1 dose and 29% have 2 doses. We need people to keep getting their first dose and move us beyond our minimum target of 75% of the entire population. And then we need everyone to get their second dose. Until we do, personal public health measures like masking, distancing, and testing will remain in place to help protect us. But if we can really boost our vaccine coverage rates this month, we may be able to reduce some of the public health measures before the end of the summer. I know we all want that, so let's work together and make it happen. Today, we invited everyone who received their first dose of vaccine on or before June 15th to move their appointment up. This will capture many of our youngest Nova Scotians. At this point, those 12 to 17 can only get Pfizer vaccine. But we are expecting a decision from Health Canada soon on whether Moderna can also be used for this age group. However, right now there are not a lot of Pfizer appointments available due to an unexpected temporary reduction in supply. We are expecting much more the week of July 25th. So for those looking to book an appointment for someone under 18, I ask for your patience. Even if your child has to wait until the end of July or early August to get their Pfizer vaccine, they will still get their second dose well before they head to school. We also continue to hear reports of people waiting to book their second dose of vaccine until they can get Pfizer. They believe that Pfizer to be a better vaccine, but this is incorrect. Pfizer and Moderna are the same type of vaccine and are both equally effective and safe. One is not better than the other. Given the reduced Pfizer supply and considering the risk of the Delta variant, please do not wait to book your second dose. If you got Pfizer for your first dose, it's completely fine to get Moderna for your second. The sooner you're fully vaccinated, the better for all of us. Thank you to everyone who's already gotten vaccinated. And if you haven't, please book an appointment and get it done. It can literally save a life, maybe yours. And it will help move us out of this pandemic, maybe even a little sooner than we hoped. And bon chance les Canadiens tonight.
We'll now take questions from media in the room and on the phone. We'll do one question and one follow-up in the time we have allotted, starting with CBC's Jean Laroche. Go ahead.
Premier, although you said you did not hide the fact that you had these DUIs on your record, you haven't, to my mind, been stated so publicly. So why are you doing that, and why are you doing that now?
I've heard some people start to ask questions, and I think I owe it to all Nova Scotians that I take this opportunity to speak directly about what happened and the lessons I learned. It was 18 years ago, and I moved on with my life. But it is known in my community where I grew up, Timberley Prospect, and obviously all my friend groups. It's something, whenever I was asked, I never shied away from that very poor decision that I made.
Was it your concern that somebody would try to use that during the upcoming campaign?
People started to ask questions, and I wanted to tell Nova Scotians all at the same time.
Moving on, we'll go to the Examiner, Tim Bousquet.
Dr. Strang, you mentioned the children in Pfizer, children being under 19, I guess. Why not limit older people to getting Moderna so that Pfizer can be concentrated among the younger people who can't get Moderna?
So there's a couple of reasons there. This is a short-term issue. It would create a significant disruption and change to our vaccine program to limit it for about a week. We also know that that people are at older age groups are actually at higher risk for severe disease. So we want to continue to get them a second dose as quickly as possible, just as a precaution against any Delta variant. I want to reassure parents that they're still getting their teens immunized well before school. Initially, when we started this plan, people of this age group, we anticipated the vaccine getting a license, weren't going to get vaccinated until the end of September, even into October. Now we're saying you just need to wait for, because of an unexpected short-term reduction in Pfizer, there's just a couple of week delay. You're still going to be able to get your young person in your life immunized much sooner, 2 months, if not more, sooner than we initially anticipated. So for the sake of our continuing, without throwing a big disruption in our overall vaccine program, it makes more sense just for this temporary delay. And then, as I said, that last week in July, we'll have lots more Pfizer coming, and vaccine appointments will be open there for all ages.
Large numbers of people getting their second doses. Seems to be diminishing returns with first doses, just a small increase every day. Looking like late this month before we hit that 75% target, if even then. I wonder if it's realistic to think that we can reach that 75% target, especially for second doses, because there's going to be a large part of the population that, or at least some people, will be missed for the second dose.
I don't anticipate it. We're very close. We believe that very soon we'll be at that minimum target of 75 for the first dose, and we still have good uptake in older age groups, well over 80%, even as we're rolling out the second dose. It keeps growing, and the total vaccine coverage. So I'm fully confident that Nova Scotians, as they've done all along, will continue to respond. They're understanding that by and large that it's the 2 doses of vaccine which gives us the opportunity to open up, gives people the opportunity to travel, to go to dinner, remove all those other restrictions, as well as keeping each other safe. So we still have absolutely work to do, but we have lots and lots of vaccine coming in the next few weeks in July. So July is a very important month for us to be able to hit those targets. And if we do so, if all Nova Scotians respond, we may be on track to be able to move, as I said, into that stage 2, which we start to remove all the restrictions much earlier than we anticipated, maybe even in August. But it depends on getting a very high coverage rate with vaccine. So I fully expect Nova Scotians are going to understand that and hear that and do what they can to allow the restrictions to be removed for themselves, as well as to keep everybody around them safe.
Next, we'll go to Lindsay Armstrong with The Coast. Go ahead, Lindsay.
Thank you. Hi, Premier. As of July 1st, there are more than 69,000 Nova Scotians who are seeking a family doctor, compared to 45,000 a year ago. And this is up more than 2,600 people compared to last month, when a new virtual care program was introduced. Given this growing and significant need, what more can Nova Scotians expect for accessing primary care as we near the end of the pandemic?
Yeah, it's an issue for all provinces, and we need to continue our efforts to recruit in a competitive landscape for more doctors and have more attachment to primary care. So we now have the highest paid doctors in Atlantic Canada. That helps our recruitment efforts. So it will continue to be an issue, but we are going to try to continue to recruit more now that our borders are opening up. I expect some of those that are going to be immigrating in to have a more streamlined process to come in. But it is something all provinces are grappling with right now.
Go ahead with your follow-up, Lindsay.
Thank you. And a question for Dr. Strang. I'm wondering if there were any remaining AstraZeneca doses. The last number I knew of was 2,000 of that batch that was set to expire at the end of June. I'm wondering if there were any left over at the end of June.
There was some uptake of that at 2,000. I don't have a final number of how much of that was taken up. Yeah, we can certainly get that and look how much ultimately was unused, but I don't have that in front of me right now.
Next, we'll go to the phones, starting with CTV's Natasha Pace. Go ahead, Natasha.
Thank you. Premier, I'm wondering whether or not we're still on schedule at this point to move into phase 4 next Wednesday, July 14th.
So far, so good in phase 3. We'll continue to monitor closely. We're still have quite a number of days to go yet to confirm that, but Dr. Strang and the team will continue to watch our cases and ensure that we're moving in that direction, but all signs are positive so far.
Natasha, do you have a follow-up?
I do. Dr. Strang, I'm wondering whether or not you could elaborate a bit more about the delay with the Pfizer vaccine. Is it an issue at the plant? Or what the case may be, and also when do you expect a decision to be made by Health Canada in regards to using Moderna for those under 18?
So both of those are really for the federal government to answer. We have not been given an explanation of the temporary reduction in the Pfizer vaccine, and we were hoping to get the decision from Health Canada last week on Moderna. It's waiting. It's sitting there waiting for Health Canada to approve that. I don't have any information on what may be causing that delay.
Moving on, we'll go to Global's Elizabeth McSheffrey. Go ahead, Elizabeth.
Thanks very much. My first question is for the Premier. You say you wanted to, just with regards to your announcement at the start of the briefing, you said you wanted to, reveal this information to Nova Scotians all together at the same time. How would you like Nova Scotians to receive this information? What would you like their reaction to be?
Well, I'm expecting probably varying reactions. I'm not expecting anything else other than to hear what I have to say and accept my apologies for my actions when I was a young man, and assure them that I am a more responsible person and that I've moved on with my life.
Go ahead with your follow-up, Elizabeth.
Thanks very much. My next question is for Dr. Strang. When we do get more Pfizer, I'm wondering if there is going to be a plan in place just to ensure that young people are able to access that, and that those doses aren't swallowed up by a surge of adults who are looking for that vaccine.
So we're certainly, at the amount of vaccine we're anticipating, we don't believe that will at all be an issue. We'll certainly continue to monitor that. But I have to repeat the message for adults who can get either Pfizer or Moderna. Do not wait if you're waiting for Pfizer. It's perfectly safe and equally effective for you to make an appointment now and get Moderna. We need adults to make that choice to get the first vaccine that's available to them, and that will certainly help to make sure that when we do get more Pfizer, it is available for those 12 to 17.
Next, we'll go to Michael Tutton with the Canadian Press. Go ahead, Michael.
Dr. Strang, you mentioned that there's two clusters and that both cases people were not vaccinated. Are these people that had the opportunity to be vaccinated and have chosen not to access it, or haven't had access to it, or why are they not vaccinated?
I'm not going to speak about individuals. We know some of them are children who are not eligible for vaccination. Others, there may be multiple reasons why they have not yet been able to get vaccinated. But we're certainly, as we respond to these clusters, we're making sure they have very easy access to vaccination. And part of the work that public health does is working with those individuals and groups to give them the accurate, appropriate information to help them make an informed decision, as I said, along with making it very easy for them to get vaccinated.
Go ahead with your follow-up, Michael.
Premier, I just want to be clear or clarify. Is this discussion of your DUIs your first public announcement of this?
I was never asked by any media source if that's the question, but it's well known in my community. It's not something I'm proud of, but this is the first time I believe that I've publicly talked about it in front of cameras and journalists.
Moving on, we'll go to the Chronicle Herald, John McPhee. Go ahead, John.
Thank you. This is for Dr. Strang. Just continuing the questions on the clusters in Glace Bay and Halifax. Are these the linked family cases that have been mentioned previously, or is it a separate outbreak? And about how many people are we talking about in these clusters?
So we've had these two clusters in existence for the last couple of weeks. They're not new clusters. I don't have a number in front of me exactly how many people are involved, but they're two clusters that have been around for a couple of weeks in different types of exposures. But as we look into them, there's a lot of close connections, but there's not an indication at this time that would suggest that there's wider spread in the general community.
Go ahead with your follow-up, John.
Thank you. This again for Dr. Strang. You said on July 25th we expect to get more Pfizer. Do we have any idea of the number of doses we're getting, and will it be enough to cover the younger population that parents are expressing concern about?
I don't have the exact number. The vaccine program folks have that. I think they're waiting for that to get finalized from the national level. But it certainly is a substantive amount of vaccine that we're expecting, so more than enough to accommodate our needs for both adults, along with Moderna vaccine, as well as for those from 12 to 17.
Next, we'll go to All Nova Scotia, Paul Bacon. Go ahead, Paul.
Good afternoon, Dr. Strang. We're hearing from some pharmacists that a surprising number of people who had AstraZeneca for their first dose are very anxious to get it for their second dose. Is that possible in Nova Scotia to do that?
We don't have any additional AstraZeneca. There are some people, unique circumstances where they cannot receive Moderna or a Pfizer vaccine, an mRNA vaccine, and we will work with them individually to make sure that they're vaccinated. For other folks, we're asking them to get an mRNA vaccine. That is a preferred choice, recommended by the National Advisory Committee on Immunization, as a better choice for your second vaccine rather than getting a second AstraZeneca.
Go ahead with your follow-up, Paul.
So not all the AstraZeneca doses have expired at this point. There is still some left for the people who need it. Is that correct?
We can access AstraZeneca as needed in specific circumstances. There are a very small number of people who cannot, for one reason or another, usually related to a specific allergy, cannot receive an mRNA vaccine, and we will make arrangements at the national level to get the AstraZeneca to them on an individual basis.
And we'll wrap things up with the Laker, Pat Healy. Go ahead, Pat.
Hi, this question's for Dr. Strang. Is there any thought of doing walk-in clinics for second dose appointments, especially in rural Nova Scotia?
Not at this time. Thanks for the question, but certainly as we're using walk-in clinics for what we call the final stages of our first dose strategy, we're focusing our second dose strategy in locations and points of access where we can get large numbers of people. As we get into the end of July and into August, when we're in the final stages of our second dose strategy, we may well consider using a walk-in approach again at that point in time.
Go ahead with your follow-up, Pat.
This question's for Premier Rankin and Dr. Strang. This past weekend, there seemed to be a lot of people traveling between Nova Scotia, New Brunswick, and PEI with the reopening of the border. What's your sense of people's response to things reopening a bit more and being able to travel in the Atlantic Canada area? Any worries about all the traveling?
Well, I think especially the Atlantic region, if you look at the cases staying low, Pat, it's been really positive when you talk to people that are reuniting with their family. There's such close connections with New Brunswick and PEI and Newfoundland, so it's been great to see some movement around in a safe way. And we'll continue to watch and monitor the impact of that restriction being eased really closely.
And that's all the time we have for questions today, Premier.
You have one more?
Well, it keeps getting tighter and tighter in terms of questions from reporters, and I don't think it's been 20 minutes. Look, I just want to follow up with, when did you first hear that someone was sniffing around your record?
Somebody just told me in my office that somebody asked about it, and I said, I'm going to confront this and go down and tell all Nova Scotians, just in case there's any ambiguity. Ambiguity, yeah.
When? Today?
Today, someone came up to me, and so...
Do you know who was sniffing around? Was it a reporter? Was it another party, or what?
I don't think that's material. Somebody asked me about it, and I want to tell all Nova Scotians. End of story. So this is an important day for so many Canadians who live abroad. The Canadian border is now open to them with some restrictions. It means friends and families who have not seen one another for a very long time can finally make plans to reunite. It also means that our Nova Scotia border is open. We have seen a lot of movement in and out of our province, and we expect it to get even busier now that the Canadian border is also open. And that's a good thing. It's wonderful to welcome people in our province again. Reuniting families and friends reinvigorates our tourist industry and our local businesses. People are on the move, but so too is the Delta variant, and it can spread quickly. That is why we have to constantly remind ourselves to be cautious and continue to follow protocols. It's easy to forget to wear your mask indoors. It's easy to forget to maintain distance, and it's easy to decide not to get a test when maybe you should if you're near an exposure site and you probably should get tested. And let's remind ourselves of a few things. Stay vigilant against the variants by following the protocols, and get your shot. And one of these things alone is not enough. All these things together will help keep our case numbers down. And Dr. Strang and I want you to enjoy your summer, and we want visitors to enjoy our province. We want them to know that Nova Scotia is a place that welcomes that warmly. Thank you.